Good morning, everyone. Thank you for joining us for today's webinar. I will give it another minute or two here just to allow folks to join. I know we're just at 10 o'clock, so we'll get started in a couple minutes with today's webinar. But thank you for joining us. All right, welcome, folks. Good morning. I think we'll go ahead and get started here. So thank you for joining us for this webinar on the Walk Cares Fund. Today we'll be covering the Walk Cares basics for self-employed workers. My name is Sebastian, and I am the Walk Cares Fund Outreach and Language Access Lead, and I will be hosting today's presentation. Joining us today, we also have Ryan, the Employer Reporting Supervisor from ESD, and we also have Alicia, the Employer Reporting Specialist from ESD. I do want to mention before we continue that we do have live interpretation. So at the bottom of the screen, you should be able to select the language that you would prefer, and you'll be able to listen in through live interpretation. We also have the DSHS customer care team that will be answering questions in the Q&A function during the presentation, and they'll also be joining us later for the Q&A portion of the webinar at the end. So anyone who has joined on a computer or maybe is using the Zoom app on their phone can submit their questions through the Q&A function at any point in the presentation. And if we're unable to answer your question during the allotted time today, you can contact us via email on our website to submit your question. This webinar will be recorded, and the recording along with the slides will be available on our website, walkcaresfund.wa.gov/webinars, within 24 hours of the completion of the presentation. And we'll go ahead and get started by talking about why the Walk Cares Fund is needed. So long-term care is help with activities of daily living. So things like bathing, eating, moving around, managing medications, but it doesn't include medical care. So things like doctor's visits and treatment for medical conditions. Long-term care isn't just for older people. So it can also help a lot of younger people with a disability, maybe an injury or severe illness as well. And a lot of people also think that long-term care means living in a nursing home or assisted living, but it also includes in-home care as well as other services. Walk Cares covers in-home care as well as many other services that we'll talk about later on as well. Things like home modifications and home delivered meals, all to help you live at home as you age. In-home care can support mental and emotional well-being as well. Um, and that's in addition to that physical support. So a 2025 study showed that home care significantly reduced people receiving care symptoms of depression, also improved their quality of life, and lowered their risk of loneliness. So with the right support, most people with long-term care needs can keep living independently in their own homes. It's also very common for family caregivers to not realize that they are a caregiver. So you might go to your mom's house a couple times a week to cook meals, maybe drive her to appointments, make sure she's taking her medications, all of which are common care activities. And the majority of this type of care is provided informally as unpaid care. And that can be from a family member, a friend, or a neighbor. And we're all at a high risk of needing long-term care. It's estimated that about 70% of us will need long-term care at some point in our lives. And that risk comes with a high cost. As you can see, getting 20 hours of home care each week for 6 months cost about $23,000 total. And even if you have a family member that is able to provide care, it's important to keep in mind the devastating financial impact that family caregiving could have on them. Because as we mentioned, long-term care is not medical care. It's not covered by health insurance or Medicare, except in some very rare circumstances. And then it's typically only covered by Medicaid after you've spent down your life savings to just $2,000. And the reality is that paying for long-term care is a problem faced not just by lower income families. Most of us don't have enough retirement income and savings to live comfortably, and then much less to be able to cover these high costs of long-term care. We know that about 41% of Washington workers near retirement have no projected retirement income from a pension, a 401k, or IRA. Another 42% have no pension and only 401, enough 401k or IRA savings to replace less than 10% of their pre-retirement income. That means that over 80% of us don't have enough savings to be able to pay out of pocket for the care that we may need as we age. So a public insurance program like WellCares gives workers a more affordable way to pay for their long-term care needs by allowing them to contribute while they're working and their income is higher. And then they can access money to pay for the care that they may need later in life when they're on a fixed income. Covering all workers also helps keep contributions low. And once you retire, or if you become unemployed, those contributions stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people access care. Unlike private insurance, which typically requires you to pay out of pocket for 90 days before you're able to access benefits, WellCares has no deductible or waiting period. This is all especially important because our population is also aging rapidly. So if we take a look at the graph here, if we look at the red line specifically, that is the population 85 and older in our state, in the state of Washington, and that population group will quadruple between now and 2050. And what we see here is the declining number of potential family caregivers. So those are folks between the ages of 45 and 64 to adults who are likely to need care, people 80 and older. Many people think, even if they aren't going to be able to pay for that long-term care as they age, that they will be able to rely on their kids, right, to be able to take care of them. And that may be true for some families today. Um, but in the future, most older adults won't be able to rely on the family caregiving as an option. Those family caregivers will also be more likely to be providing care for multiple loved ones at one time. So, for example, someone in their 50s might be caring for one of their parents or maybe their spouse's parents, but 20 years from now, someone in their 50s would be caring for two or more older adults. And even when there is a family caregiver available, that care isn't actually free. So many family caregivers have a related financial setback, and on average, they spend 26% of their own income on care-related expenses. And while caregiving can be a very deeply rewarding experience, it's also stressful. Almost a quarter of caregivers say that their health has worsened since they took on their role. And it's also really common for caregivers to leave the workforce early to provide care. Caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits combined. So, with all these challenges in mind, the state legislature began a search back in 2014 for a public policy innovation that would limit the impact of increasing Medicaid costs on the taxes that we all pay, offer affordable long-term care insurance coverage that provides financial relief to middle-class families, and also be financially sustainable over the long run. So the committee tasked with this challenge spent several years working with different stakeholders, policy experts, and actuaries to explore both public and private solutions. And after that extensive research on both approaches, they found that a program like Walk Cares that covers everyone, so similar to Social Security and Medicare, is the only way to provide affordable coverage for all. We also know that public pension, healthcare, and long-term care insurance programs where all workers participate have been successful throughout the world. This approach keeps contribution rates low and also ensures coverage for everyone, regardless of their age, their gender, or health status. So, after considering a variety of options, in 2019, the legislature passed a law creating law cares. In 2022, the legislature made improvements to the program's coverage and benefits. Workers began earning benefits in July of 2023. In 2024, the legislature gave workers the ability to take their benefits out of state. And last year, the legislature created a market for supplemental private insurance policies that work seamlessly with WellCares. And this market is expected to go live by early 2027. They also gave workers who currently have a private insurance exemption a window to join WellCares. And in July of this year, the benefit will become available statewide to those who qualify. So to earn benefits, Washington workers automatically contribute 0.58% of each paycheck during their working years. And you only contribute while you're working. So again, if you retire or if you become unemployed, those contributions stop. Everyone is covered at the same low rate, regardless of any pre-existing conditions. And starting in May, you'll be able to apply for benefits. You'll need to meet a contribution requirement and a care needs requirement, which we'll talk about shortly. And then once you're approved, you get to choose how you want to use your $36,500 benefit. That benefit is a lifetime benefit amount that grows with inflation. You'll be able to choose any covered services that you want, and there are no out-of-pocket costs when you need care. So we pay the providers directly for the services that you receive with no copay or deductible. So to get a sense of what those contributions look like over the course of a career, if we look at the middle column there, a worker who earns about $59,000 a year, they pay $29 in contributions per month, which adds up to just over $10,000 total over a 30-year career. And in order to earn less in benefits than you contribute, you'd have to make an average of $210,000 each year over the course of 30 years. So if you are self-employed, you can choose to opt into the Walk Cares Fund and protect yourself with the same affordable benefits available to other Washington workers. Like other workers, you would contribute 0.58% of your net earnings and any gross wages. To earn benefits, you must work at least 500 hours per year. Coverage must be elected by June 30th of this year if you're currently self-employed or within 3 years of becoming self-employed for the first time. Applications to opt in became available in July of 2023, And I know Ryan and Alicia will speak more to this as well in a little bit. Everyone who is contributing to the Walk Cares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. So to qualify for benefits, you have to meet one of the following contribution pathways. We have the permanent pathway, which earns you the full benefit amount by contributing for at least 10 years, and this is at any point in your career. And we have the temporary pathway, which earns someone the full benefit amount if they've contributed for at least 3 of the last 6 years at the time that they apply for benefits. And then we have the transition pathway, which will earn someone lifetime access to 10% of the full benefit amount for each year that they contribute. This is specifically for folks who are born before 1968. And these workers can also earn access to the full benefit amount if they qualify through one of the other pathways. So, for example, if you work and contribute for 500 hours per year, at least 500 hours per year for 2 years, you'd earn 20% of that benefit amount, which is about $7,300. So to use your benefits, we must determine that you need help with 3 or more activities of daily living and will continue to need help for at least 90 days. So the activities that we assess are the ones that you can see on the screen there: bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. We also understand that cognitive limitations can affect a person's ADLs, so the care needs requirement was developed to ensure it also includes individuals who need assistance due to cognitive impairment, so needing supervision, cueing, or reminders. And then when you're ready to apply for benefits, you'll start by creating an online Walker's benefits account. You can also have someone else help manage your account. Your local area agency on aging will also be available if you need more support. And once you submit your application, we'll confirm you've met the contribution requirement. Then you'll be able to schedule an appointment to talk about your care needs. And after we meet with you, we'll let you know if you're approved to start using your benefits. Or benefits become available statewide. We are piloting our entire system in Lewis, Mason, Thurston, and Spokane counties with a limited number of applicants. Residents of those counties can currently apply through March 31st, so we are nearing the end of that pilot of the pilot. But then on April 1st, here soon, you'll be able to create an online account, which you can use to check annual contribution statements, and that will also be where you eventually apply for benefits. And then on May 18th is when applications for benefits will open statewide. And July 1st, as we mentioned, is when all beneficiaries can start receiving services. So once you've been approved, you can use your benefits to receive any of the covered services and supports from a Walk Cares provider. So for example, you may want to choose services to help you stay in your own home. So things like in-home care, home modifications, home delivered meals, or adaptive equipment and technology. We also cover many services that support family caregivers. So you can get paid care from a loved one, including your spouse, or you can get respite care so that they can take a break. We cover education and consultation to help them manage your care. We also cover dementia and behavioral supports, care transition coordination to support you when you leave a facility like a hospital. You can choose to receive services in your community as well, so things like an adult family home or adult day services, or you can choose to receive care in an assisted living facility or nursing home, including memory care. So just to get a sense of how far the benefit will go, about a third of people need care for a year or less. So for those people, depending on the services they choose, Walk Cares may be able to cover all or most of the care that they need. For others, walk carriers can provide your family with immediate relief and also time to plan for future costs. So these again are just some examples of how someone could use their benefit. And just to focus, we can walk through one example. Again, all these slides will be available on our website as well to take a more detailed look. But if you'd like to pay a family member, for example, for care, you can receive care for 10 hours per week for 2 years and also get care supplies for under $35,000. I mentioned also that the creation of the supplemental private long-term care insurance market. So this is similar to how Medicare works. The public insurance provides a foundation of financial security for everyone, and then private options are available for those who want more coverage. So these supplemental private policies will kick in seamlessly once you've used up your Walker's benefits. The policies will also have stronger consumer protections than private long-term care insurance today. So the Office of the Insurance Commissioner will complete rulemaking by May of this year, and then policies could become available as early as 2027. And starting in July, you can choose to continue participating in walk cares if you leave the state. So to become an out-of-state participant, you must have contributed for at least 3 years, working at least 500 hours or more per year, and then you must opt in within a year of leaving Washington. And so just like other workers, out-of-state participants will keep contributing to the fund during their working years. The process for out-of-state participants to report their earnings and pay premiums is still being worked on, but obviously the focus is making sure it is as simple and easy as possible for them to do that. And then starting July of 2030, out-of-state participants will be able to access benefits outside of Washington. And so with that, I'm going to pass it over to Ryan.
All right, thank you, Sebastian. Good morning, everyone. Now we're going to start talking about self-employed individuals and opting into elective coverage and some of the reporting requirements. So here are some examples of self-employed individuals. You can see we have several types: sole proprietor, joint venturer or member of a partnership, independent contractor, member of a limited liability company, transportation network company driver after June 9th, 2022, or otherwise in business for yourself. And we do want to mention there that we've got limited liability company up there, but it also, for example, it could be an LLP or a PLLP, etc. And if you are unsure if you're unemployed, please don't hesitate. Excuse me, if you're self-employed, please don't hesitate to give us a call or send us an email, and we can discuss your situation with you and help you get that figured out. And next, I'm going to pass it off to Alicia. She's going to walk us through creating an elective coverage account and opting in to the program.
Hi, good morning, everyone. My name is Alicia. Yeah, I'll be helping you with how to create an elective coverage account. So first off, if you're going to start with Secure Access Washington, if you already have an account, of course, you'll just log into that account. If you do not have an existing account, then you'll want to create a Secure Access Washington account. Once you have created that account, what you'll do is you'll access, if you already have the paid leave service, you'll click Access Now and add your self-employed elective coverage. If you do not, then what you'll do is you'll search by listing a browse, blah, blah, blah. Add service by browsing a list of services by agency. You'll go and scroll down to Employment Security Department. You'll click on Apply for Paid Family Medical Leave and click OK. At this point, your service is now added to your home page. You will need to complete the multi-factor authentication. This is a new security access that they've been using. Once you've created that account, what you're going to do is say create a new account. You're going to elect coverage as a self-employed individual. Just to note, you are not able to elect on behalf of another individual, only for yourself. From there, you're going to complete the questions on the personal information page. You will use your social security number or your ITIN. If you have multiple businesses as a self-employed individual, you're still going to just report under your social security number, so your one account. You'll confirm the information is correct, click submit. From there, you'll be able to go back to the home screen. Now, if you get lost in this process, because there is a lot of steps, please use our main line to call for assistance with the process, or there are instructions on our website at paidleave.wa.gov under technical support. All right, if you can go to the next slide, please. All right, once you've created the account, here is where you will click, you will opt in. Here it's going to have the options for paid leave and WACARES. We do advise that before opting in, you click on the information icon to read more on the program. If you have an active exemption account or an approved exemption, the system will not allow you to elect for WACARES or select coverage for WACARES. If you do choose to opt into WACARES, please read the attestation carefully, and it will ask you to enter in your driver's license number. Next slide, please. Okay, just a little bit information about if you choose to opt in to elect coverage for WACARES. The opt-in started July 1st of 2023. You do need to opt in by June 30th of 2026 or within 3 years of becoming self-employed. You may not withdraw coverage unless you are not self-employed any longer, but once you opt in, you're opted in for life. You will be required to pay premiums until you are no longer self-employed or retired. You are responsible for 100% of all premiums assessed to an employee. There is no Social Security cap for the Washington Cares premiums. Individuals with an approved exemption will not be able to elect coverage for WACARES. All right, and I'll pass it back to Ryan.
Thank you, Alicia, for those details. Next, we have the WACARES premium calculation. It is a simple calculation since it is self-funded by the employees and there is no employer portion of the premium. The premium is 0.58% of your reportable income. And your reportable income includes your net earnings and gross wages paid to you from your business entity. And there you can see in the bottom corner, we gave you a little multiplier there as well to make it easier for you to estimate and calculate your premiums. You'll just take your reportable income and multiply that by 0.0058. And as Alicia mentioned, we do want to reiterate there is no Social Security cap for the WACARES program. Important dates for elective coverage. So it began July 1st, 2023. Self-employed could begin electing coverage at that point in time. Now, the way that it works is when you create that account that Alicia walked us through, and then you opt in. That's the notice of election. Then your elective coverage effective start date begins the quarter after you opt in, and then you'll wait until the following quarter to log into your account to report your earnings and remit those premiums. So for example, if you were to log in today on 3/25 and elect coverage, the effective start date would begin next quarter, quarter two, beginning on April 1st. And then you would not report your quarter two earnings until the beginning of quarter three in July. And again, we do want to reiterate that there is no Social Security cap for the WA Cares program, and that is different from the paid family and medical leave program. Next slide, please. Canceling elective coverage. There is no option to withdraw after you have elective coverage for WA Cares. WA Cares elective coverage is permanent. But if you retire or are no longer self-employed, you must notify the department to cancel your elective coverage account. So please make sure you do that if that is the case. But we do want to note that Employment Security Department may cancel elective coverage if the individual fails to make required payments or file their reports. And next up, Alicia is going to walk us through some of the comparisons of the paid leave and the WA Cares program.
Yeah, thank you, Ryan. So, yep, there are some fundamental comparison or differences between the paid leave elective coverage and the WA Cares elective coverage. So for paid leave, you can opt in anytime during your self-employment. The initial coverage is for 3 years, and it renews automatically each year after that. Or at the end of the 3 years, the system will give you the option if you would like to opt out of paid family medical leave and choose not to participate any further. If you do not opt out, it will automatically renew. The employee shares the premium. And for paid family medical leave, there is a Social Security cap, and that Social Security cap is changed or updated every year. So for the WA Cares Fund, you got to opt in by June 30th of 2026 or within 3 years of becoming self-employed. Again, reminder, the coverage is permanent until retirement or no longer self-employed, in which case you will need to notify ESD. You will pay the full premium, and there is no Social Security cap. So some of the common differences between the program is the definition of a self-employed individual, the definition of wages and hours, and then same reporting requirements and deadlines.
Great. Now we are going to start the Q&A portion of the webinar. If you have a question, you can enter it using the Q&A function at the bottom of your screen, and we will answer them live. The first question, Ryan and Alicia, I don't know if you want to come on camera. I think most of these will be for you guys. The first question is, if I'm a single member LLC, am I automatically opted into WA Cares or can I opt out?
Good question. If you own any percentage of an LLC, you are considered self-employed. So you are not a part of the program automatically. You need to opt in and elect coverage.
Do S Corps fall into the LLC category?
Uh, Technically, no, not always. It is possible that an S Corp could be something else other than an LLC. S Corp is a federal tax designation, and we don't take a look at the federal IRS designations. We look at the entity type, which is established at the state level. So what we would just look at is, are you an LLC or not? That S Corp part of it, to put it simply, doesn't matter.
Um, some of the questions, it looks like we're referring to specific slides. If you could re-ask your question in a complete sentence, that would be helpful for us to know what you're referring to. Um, if I am a part-time W-2 worker and also self-employed, what do I do?
Part-time W-2 as in for another employer, or do you mean W-2 as in you're putting yourself through payroll, part of your own LLC?
Another employer.
Yeah. So for the wages that you're doing part of your self-employed, um, that would be not automatically a part of the program. You would need to opt in and elect coverage for that. Your W-2 earnings would be part of the Walk Cares programs unless you have a one of the various exemptions that are available out there.
If if the LLC is structured to pay the self-employed individual wages
Hmm.
and have been making contributions since 2023, do you have to go through a separate opt-in process?
Okay, if I'm understanding that question, it sounds like the LLC owner has been reported as an employee. So you would want to contact us and we can walk you through essentially getting some amendments on that account and walking you through opting in if that is what you wanted to do. Hopefully I understood that question correctly.
If you're in a partnership, do both members have to opt in or can just one member opt in?
Good question. That's individual. So if one wanted to opt in, they could, and if the other doesn't want to, they don't need to. It's a really good question.
If you've been self-employed for more than 3 years, is it correct that you can no longer opt in?
Yes, the date, I know that was in one of the slides. My apologies. I don't know off the top of my head. But it, if you were self-employed, was it July 1st, 2023?
So they have until June 30th of 2026. So June 30th
Thank
of
you.
2026 this year is the deadline to opt in. And then after June 30th of 2026, that's when the 3-year requirement will take effect, if I understand correctly.
Thank you, Alicia.
Yeah.
Um, I'm gonna move to some questions from the registration form. If you do have a question, feel free to continue asking them in the Q&A. Um, sorry, just reading through these. If I am a self-employed caregiver, am I still able to opt in? Like if you're a paid family caregiver, it says I am a self-employed caregiver for my wife. Can I still opt in?
Absolutely. Yeah. If you're considered self-employed individual, you can opt in.
To report an S Corp shareholder Walker's contribution, do we need a separate reporting account?
Not sure if I'm understanding that question. I might need a little bit more detail on that, but I'm thinking no.
How are hours determined? I believe I understand the amount of net earnings divided by minimum wage. Is that correct?
Yes. Yep, that is correct.
Um, if I'm an individual contractor and working as a W-2 for a different employer, can I still opt in? I think we already answered this, but if you can answer it again.
Yep, absolutely. You can opt in for your self-employed earnings if you would like, and then your W-2 earnings should be reported already, unless you had an approved exemption.
If I have an ITIN, can I participate?
Yes.
Okay. Um, Looks like all the questions in the registration form are answered. I'll give people a few more minutes if they have questions that we can answer in chat. Is there somewhere we can go to get more examples of what is considered net earnings and gross wages or definitions of those?
We have an elective coverage toolkit on our paid leave website. So if you want to go to paidleave.wa.gov, when you get there, click on the Help Center tab. Then you'll want to click on Employers and Employer Agents, and you'll see our elective coverage toolkit, and it'll break down lots of good information for you. And of course, if you still have questions, give us a call or send us an email.
When submitting S Corp payroll contributions at the end of each quarter, can the shareholder contribution be reported under the company's reporting account, or do they need a personal separate account?
I don't think that would be reported. We'll probably need to write that down and get back with you on that one. I don't know if Josh can take that down for me.
I also think some of that information will be in that toolkit as well that talks about what to report as a self-employed individual. So the different kind of contributions.
Next slide, Sebastian. As soon as you exit out of today's webinar, a survey will pop up on your screen. If you could take a few minutes to complete the survey, we would love to hear from you. Next slide. As we mentioned earlier, the recording of today's webinar, along with the slides, will be available on our website at wahcaresfund.wa.gov/webinars. If you have any questions that we were unable to get to during the Q&A portion of the webinar, ESD, which is where Ryan and Alicia work, you can contact their help center at this 833-717-2273 phone number. If you have other questions, general questions about WACARES, not specific to elective coverage, you can contact DSHS at 844-CARE4WA, or you can send us an email at through this website link here on the left. We appreciate everybody taking time to join us for today's webinar. We host monthly webinar series, 2 webinars a month. If you're interested in registering for future webinars, registration links are also available on this website, wahcaresfund.wa.gov/webinars. Thank you all for joining, and we hope you have a great day.